The National Primary Healthcare Development Agency has expressed its commitment towards supporting traditional rulers in the fight against the lingering polio pandemic in the 19 northern states of the Federation. NPHCDA Executive Director Dr. Faisal Shuaibu made this declaration during the strategic meeting with Northern Traditional Leaders Committee on PHC delivery strategy with traditional leaders of inaccessible areas in Kaduna. Dr. Faisal Shuaibu said the agency will remain resolute, in educating, enlightening and advocating across communities on the significance of its fight against polio so that their respective areas will be polio-free. The Sultan of Sokoto, Saad Abubakar, and the Emir of Argungu, Samaila Muhammad Mera, said the traditional leaders in the 6 states will be involved fully for ensuring polio vaccination exercise reaches targeted children in their respective areas. While the governor of Kaduna State, who was represented by his deputy, Dr. Hadiza Balarabe, calls on all well-meaning Nigerians to be involved in this fight to eradicate polio completely in the country.
We do not lack the problem solutions to our problems because of meetings. What we lack is implementation. Because we sit down here and we talk very beautiful Hausa, beautiful English, but no beautiful Gangi, beautiful Hausa, a full day. They speak in very beautiful language. Attaching the taro, we go to our homes, and that's the end of it. We come back again, we repeat the same thing without implementing the previous decision we have taken. That's why we urge our leaders, especially the political leaders, try and implement. If you have a 10-point decision that you arrive at, I need 2, 3, or 4. For us to know we have started somewhere. It's not possible to do everything at the same time. We know the problems we face, but we should be implementing some of the resolutions that were taken.
We have the tools, we have the knowledge, and we have the experience and the collaboration with the traditional leaders. This is why we're here today, because we want to listen to the traditional leaders to understand better how we can actually reach children that are now inaccessible due to security challenges. They have to be the ones, because they are closest to their communities, to help us figure out how we can reach these children. Where are these children, even with the insecurity in their communities? What is the best way for us to reach them with primary healthcare services? It is only our collaboration, solidarity with our local leaders that made it possible for us to eradicate the white polio virus. This is why we're going back to the trenches, again seeking their support, their leadership, to make sure that we actually eradicate the CVPV2s by the end of this year.
UNICEF Nigeria is committed to partnering with the government of Nigeria to strengthen the primary healthcare system in several ways. In this year's campaign, UNICEF has supported the states with campaign vaccines, such as the delivery of about 8 million doses of FIPV, 26 million units of 0.1 milliliter syringes, and 1.5 million doses of MOPV vaccines. To increase the demand for vaccination in communities, UNICEF supported 3 states, namely Kaduna, Kano, and Katsina, to engage 3,000 volunteers within the community to supervise the delivery of these vaccines.